Hi, I'm Ron Klimmer. As part of my responsibilities with FHI 360, I serve as the Director for the Secretariat for the Global Handwashing Partnership. The partnership and all of our organizers of today's session would like to acknowledge the generous support of World Vision for supporting today's session. World Vision is also a core partner of the Global Handwashing Partnership. And so we just want to say thanks to our colleagues at World Vision. Thank you. Next slide. In today's session, we'll be talking about where we are with hand hygiene and where we hope to be going to achieve hand hygiene for all. It's really some of our close partners that we're working with today that we're involved with initiatives all throughout the year. So I'm just honored to be working with them today, as well as with all the initiatives we work with them. Next slide. In today's session, we'll be starting with a bit of a sneak peek of the State of Hand Hygiene report. After that, we'll be moving into a discussion of the development of the research agenda for hand hygiene. And then we'll have a discussion about the capacity building needs to achieve hand hygiene for all. And then at that point, we'll be able to hear from you and your perspective on what's been presented today, to see if what's been presented matches what your reality is, so that you can help us to address these questions. And then we'll have just a bit on the way forward. So with this, I'd like to hand it over to Nat Painter, who's with the Hand Hygiene for All initiative at UNICEF. Nat?
Terrific, thank you, Ron. And thank you everyone for joining this lunchtime session. I think the challenge of lunchtime sessions is everyone watching gets to eat, but nobody speaking actually gets to does. So apologies if our blood sugar starts dropping over the course of this. As Ron mentioned, I'm Nat Painter. I'm the global coordinator for UNICEF of the Hand Hygiene for All initiative. Just for a bit of context, the Hand Hygiene for All initiative was launched in June 2020 by UNICEF, WHO, and a coalition of leading hand hygiene organizations. It has a dual purpose of supporting governance in strengthening their hand hygiene programs, as well as expanding the hand hygiene conversation to include other settings, workplaces, public spaces, refugee contexts, et cetera, looking beyond the domestic schools and healthcare facilities where the discussion has been focused so far to date. Just a little bit of backstory. I began working on hand hygiene back in 2004. But I left the sector in 2011. So it's been a decade since I've been involved in this. And coming back now, I'm really struck by how much has progressed in that time, as well as the challenges in front of us. We've really seen a remarkable increase in access to hand hygiene over that time, but we're also challenged by the need to significantly step up progress. As Ron mentioned, much of this analysis is captured in the forthcoming State of the World's Hand Hygiene report. This will be released on Global Hand Washing Day, so you can consider this a teaser for the report itself. But I certainly encourage you to both join us for the Global Hand Washing Day celebration and to read the full report when it's released. So I'm going to say a few things that are probably pretty familiar with the people on this call, but I just really think it's important to repeat them. They really bear messaging out again and again. Hand hygiene is one of the most important measures to prevent the spread of infectious diseases, including diarrheal diseases and respiratory diseases. These are the leading causes of death for children under 5. And again, really just can't say this enough. 3 out of 10 people around the world, that's 2.3 billion people globally, they lack a hand washing facility with water and soap at home, including 670 million people who have no hand washing facility at all. Over 800 million children are lacking basic hand hygiene services at their schools, and over half of which go to school with no hygiene services at all. And then nearly a third of healthcare facilities also do not have access to hand hygiene where care is provided. Now, this is, a stream of really challenging situation of the world right now, and the impacts of this are quite severe as well. It's been estimated that 500,000 people die annually from diarrheal or acute respiratory infections, which could have been prevented by practicing good hand hygiene. And looking into healthcare facilities, appropriate hand hygiene prevents up to 50% of avoidable infections acquired during healthcare delivery, including those affecting the health workforce. So obviously, we need to change this, and we really need to change it faster than we are currently. The current efforts that we've seen to date need to quadruple to achieve universal hand hygiene in schools and domestic settings. Of course, this is, when you're talking globally, you tend to average away some of the nuance that is relevant at the country level. So some countries are moving faster than others, but nonetheless, there's an urgent need for all of us to accelerate our efforts. Critically, with a few notable exceptions, very few countries have made significant efforts to tackle the need for hand hygiene in public spaces. And I think, as we've seen during COVID-19 and the crisis that it has spawned, the role of transmission in public spaces is a huge challenge for all of us to face. At the current rate of progress, by 2030, the world will have reached only 78% coverage of basic hygiene services. And that's leaving nearly 2 billion people without the facilities to wash their hands at home. This is unneeded, unnecessary, and it's solvable, but it comes at a cost. So just to lay this out in blunt terms, achieving universal hand hygiene by 2030 in all domestic settings would cost $11 billion. This number, it's both an enormous number, but it's also vanishingly small when it's compared to the results that it would engender. The costs to governments for initial and subsequent hygiene promotion are estimated to be about 25 cents per capita per year. This is taken from the 46 least developed countries in the world. This is roughly equivalent to 2.5% of the median government health expenditure in these countries. So yes, this is a not insignificant investment, but investing in hand hygiene also yields huge returns. One estimate places the economic savings associated with hand hygiene policies at, on average, 15 times the cost of implementation. So the potential impact, the potential positive economic benefit from this is really extraordinary. We've known for a long time, since at least the 1850s, that hand hygiene is a good idea. COVID-19 pandemic has brought renewed attention to it, but so did Ebola and SARS and other previous epidemics. Attention is temporary, but hand hygiene is always a good idea. So the challenge lies in taking this moment of unprecedented support, collaboration, and resources for hand hygiene and converting it to momentum. And there is momentum to build from. Over the past 5 years, 300,000 people per day gained access to basic hand hygiene facilities. That's over 500 million people in half a decade. Just want to take a moment to reflect on that. Yes, we need more investment, and yes, we need better monitoring. Yes, we need much more attention to hand hygiene in public spaces, workplaces, refugee contexts, but that achievement is remarkable. 500 million people. And I just want to applaud all the hand hygiene warriors around the world who contributed to that extraordinary progress. So with that brief summary of where we are, I'd like to hand the session over to Robert Dreibelbis to update us on what we know and critically what we don't know about hand hygiene. So thank you. Please join us for Global Hand Washing Day on October 15th and the launch of the State of the World's Hand Hygiene Report. Robert, over to you.
Hi, Nat. Thanks. And hello, everyone. Again, sorry we aren't able to meet in person this year. I'm going to speak briefly about some work we've been doing on a hand hygiene kind of learning agenda or learning map that we've been leading as part of our work with the COVID-19 Hygiene Hub, which is housed at the London School of Hygiene and Tropical Medicine, and working with a number of partners on this. My name is Robert Dreibelbis. I'm an associate professor in the Department of Disease Control at LSHTM. Can switch to the next slide, please. So kind of stepping back briefly and thinking about what we know and what we don't know about hand hygiene, I'm unfortunately going to focus more on what we don't know and some of the emergent priorities, just because it's a lot easier to discuss kind of the things that we don't know rather than explain what we do. But just some highlights in terms of what we have kind of established over the past years. We know that knowledge and disease risk are not the only determinants of hand hygiene behaviors. We've identified a number of motives, emotional drivers, habits, all kinds of things that really do actually influence when and how we wash our hands. Next slide, please. We also know that kind of these determinants of our hand hygiene behaviors are not static, and they can change over time, and they can change quite rapidly. A good example of this is thinking about your own hand hygiene behaviors throughout the COVID-19 pandemic. It started, there was a lot of uncertainty. I'll speak for myself here rather than saying you, and let my story be told. It's kind of washing my hands constantly at the beginning when we all thought kind of hand hygiene was the number one thing. And then as the pandemic continued, new information emerged. We kind of normalized ourselves to new concepts of risk. A lot of that kind of our initial kind of emphasis on hand hygiene or our own hand hygiene changed over time. So we can see even with that's kind of an extraordinary situation, but we do see that these determinants change and can change kind of as the context around us adapts. Next slide, please. We know that access to soap and water are a necessary component of hand hygiene. Next slide, please. But we also know that we can now use these things a little bit more creatively. I think in the past, we've often thought about behavior change messaging versus kind of hardware components. And now we're seeing kind of ways that we can bring these together through various kind of innovative approaches, such as surprise soap, using nudges, using kind of cues within the environment, kind of get this all to hang together. Next slide, please. So what we've been doing as part of the COVID-19 Hygiene Hub with a whole range of partners is really mapping the evidence around hand hygiene and the hand hygiene literature. Given the wealth of information that we have and the wealth of published information, we've really been focusing on the systematic review literature. So these are either systematic reviews or scoping reviews. And we found 213 that have been published since, we found 213 of these that have been published so far. 121 of these are very specific to hand hygiene in healthcare settings. So those are being kind of pulled apart and being synthesized separately. I'm going to talk about the other 100 or so that are related to hand hygiene in the domestic setting, in schools, and public settings. Now, one thing that immediately jumps out here is that about 40 to 50% of these systematic reviews, or where we've gone out and systematically searched through our published knowledge, almost half of this information concerns itself with one specific question. What is the relationship between a hand hygiene intervention and some type of health outcome? I think anyone here has probably known we've kind of seemed to be redoing these meta-analyses quite frequently. Here's just 3 examples that are really looking at this relationship between interventions and health outcomes. But there's a whole lot of synthetic knowledge that we have that addresses the rest of this. Kind of next slide, please. And we need to remember that between an intervention and a health outcome is an entire causal pathway. And we need more information to really better understand what's happening along this causal pathway. Now, these are just generic terms. We can adapt and we'll be moving and revising this, but we can think intervention should be changing something kind of psychological. Those are knowledge, attitudes, or beliefs. They are probably doing something about infrastructure and supplies or hand hygiene services. Collectively, those are going to be influencing our hand hygiene behaviors, which in turn are what's actually influencing our health outcomes. So if we start taking apart this causal pathway, next slide. When it comes to hand hygiene interventions, what we're finding across the literature and across all of these systematic reviews is that our interventions are very poorly and inconsistently described. We often say we did an intervention, but we leave out anything of a lot of the key information that would help us really understand what that intervention is telling us. We often kind of implement hand hygiene as part of an integrated component, but we not really provide enough sufficient detail to kind of disentangle what the impact of hand hygiene is separate from any other intervention component. And then overall, we really do suffer from a lack of long-term robust studies, particularly in schools and other institutional settings. We tend to focus on very short-term time horizons with these interventions, and we really just have a lack of data. Next slide, please. Moving through this causal pathway, if we think about kind of these intermediary determinants, so things like knowledge or infrastructure, we really often have no information on the exact determinants that are targeted by interventions. We've talked quite a bit in the past, if you've been paying attention to hand hygiene literature, that things like social norms are incredibly important. But we don't actually explain how our interventions are targeting those norms. What's that causal pathway we're really trying to set up here? We have really limited information on intervention content or mechanisms. There is a slight focus shift on this, particularly around behavior change approaches that are used in schools or younger children. But overall, we really don't have any systematic way to kind of compare these things. And we don't necessarily always understand what the most important determinants are within a specific context. Next slide. Around when we focus on hand hygiene behaviors, what we often lack is kind of information linking interventions to behaviors, specifically around things like intervention intensity or intervention frequency. What's the dose of an intervention that's really going to result in kind of lasting behavior change? And we also have very little information that we can pull together about the effectiveness of specific delivery channels on promoting behavior change. Next slide. And finally, kind of looking at that last bit here, where we're trying to connect behaviors and health outcomes, what we've largely focused on in the literature so far is a very crude and simple measure of hand hygiene. We don't really get we have very limited information on frequency and its relationship to health outcomes, and what the real impact of things like timing, duration, and quality are. Next slide. So kind of the missing component of all of this is hand hygiene policy. There's no information out there, or there is, we just haven't bothered to really go out and pull it together into systematic reviews. There's really limited information on hand hygiene policies, which we know are going to be critical to achieving universal hand hygiene. Next slide. So just to summarize these key gaps, for policy, we have limited systematic analysis on how policy influences behavior or health impact. We have inconsistent reporting on intervention components, targeted determinants or delivery mechanisms, and very limited information on the dose that's critical to achieve kind of long-term effect. And then for behaviors, we have really kind of sparse information on the actual link between behaviors and its link with specific health outcomes, other than we did an intervention. Next slide. So we didn't want to stop here with just kind of pulling together and looking and see what we can and can't find. We've been kind of managing, as part of the Hygiene Hub, a large-scale consultation process. This is being led by partner organizations for schools. This is partners at Emory University. For public and community spaces, this is partners at the African Population Health Research Center. And for domestic settings, there are partners that are leading on this from ICDDRB and World Vision. Next slide, please. So some of the emerging priorities that are coming out of these consultation process, if we think about measures and methods across all of the settings or everything that we've looked at, we really do kind of one thing that has emerged as critical is standardized reporting criteria to really help us make comparisons across context, across interventions, and to better understand their comparative effectiveness. And across all of these things, we also need consistent approaches to measuring and reporting on hand hygiene behaviors, focusing specifically on public and community settings as it relates to methods and metrics, is we really need to define the best practices for design and evaluation of hand hygiene studies in public spaces, and a definition of the key behaviors and indicators that we can use in research related to hand hygiene in public spaces. Next. So kind of pulling this apart a little bit. So some of the emergent research questions that we're finding through this consultation process across all of the settings, kind of as it relates to policy, just general research questions on what the current policies are and how resources are allocated to implement and monitor those policies. Also across all of these settings, questions on the comparative effectiveness of various policy approaches. Specific for schools, there's been a kind of a high priority research questions identified about how national and local resources are allocated to hygiene services in schools. For public settings, there's just kind of a lack of knowledge. So really, what are the policies that need to be in place to ensure effective hand hygiene in public spaces? And for domestic settings, how could we really define the enabling environment? And what does that actually mean from a policy perspective? Next slide. When it comes to interventions, the greatest number of identified research questions were really related to interventions. And this was across all of the settings. And it makes sense here. If we think about it, some of the things that people are asking about are what are the costs and cost effectiveness of various interventions approaches? How should interventions be designed and delivered to ensure sustained behavior change to really achieving long-term universal hand hygiene? And how can interventions be adapted for specific populations and specific groups? Next slide, please. When it comes to behaviors, I think we, kind of in the domestic context, there seems to be a consensus that we understand the key behaviors here. But when it comes to school and community spaces, there's a little bit more question here. For schools, it's really when is hand hygiene being promoted among school-age children? And one specific question is what really is the role of alcohol-based hand rub in promoting universal hand hygiene in these settings? For public and community settings, it's really a lot of unknowns here. What are these critical junctures and what's the necessary frequency, duration, and timing of hand hygiene in these public spaces? Next slide. So I didn't mention impacts. There's a general consensus across all of these groups that impacts, we actually know quite a bit about this, or we really need to pay more attention to understanding that big causal pathway. So right now we're sitting down, all of these research questions, we just got those within the past few days, and we're pulling those together and working with partners on developing a coordinated set of questions. But if you'd like to be involved and kind of provide some consultation in this, please do get in touch at support@hygienehub.info, and we can direct you to the appropriate working group here. So with that, I will stop. I think our next speaker will be Erin Palomares from a Global Hand Washing Partnership, discussing capacity building needs and resources for hand hygiene champions.
Hi, Robert. Thank you again. Sorry, I had some trouble unmuting myself there. But as Robert said, my name is Erin Palomares, and I serve on the Global Hand Washing Partnership Secretariat. The Global Hand Washing Partnership is a public-private partnership that serves as a global advocate and knowledge hub for hand hygiene programming, and our secretariat is hosted by FHI 360. We're really excited to have this discussion with you all today. Next slide, please. So we want to shift this session now, linking Robert's presentation around the work from the hand hygiene research agenda process, and discuss how those efforts can link to current and future resources for capacity building among hand hygiene program implementers. And the priorities and questions at the end of his presentation do a great job in considering the perspectives of practitioners and capturing that lens. And so now we want to bridge that gap and focus on translating those questions and priorities into practice and key resources. In our presentation, we'll shift our focus slightly and discuss what we know and don't know for hand hygiene capacity development, leveraging some of these key points to inform future resources, trainings, and guidelines. Next slide. So to start, I want to make note of a couple of points that we do know. Despite its cross-cutting benefits, hand hygiene remains neglected in many programs. Oftentimes, hand hygiene is incorporated into broader WASH programs or programs focused on a specific outcome. There's rarely, if at all, a large-scale program focused on hand hygiene behavior change on its own. So like Robert mentioned, it's important that we understand hand hygiene as a component of other key programs. There's seldom a hand hygiene focal point or subject matter expert across programs or organizations. This is just a reality in many programs and organizations, and it can be a capacity issue. Staff may wear multiple hats, so the person designing, implementing, monitoring, and evaluating hand hygiene interventions may have varying levels of experience with hand hygiene. And then the last point here, resources often focus on hygiene education or knowledge rather than the skills needed to effectively design and implement hand hygiene programs. And again, as Robert mentioned, knowledge and disease risk are not the only determinants of hand hygiene behavior. And we'll go into this in more detail in a few slides, but there is a gap in resources that go beyond hygiene education alone. Next slide. I do want to start by talking about what is currently available though. So the Global Hand Washing Partnership sought to address some of these points through our Hand Washing Handbook, which was launched last year. And the handbook is an all-in-one resource for hand washing implementers, and it provides practical guidance in support of hand washing interventions. Next slide. The Hand Washing Handbook has 4 main chapters, each discussing specific elements that need to be addressed in order to move the dial for hand hygiene. And I'll go through each in a bit more detail. So the first chapter focuses on making the case for hand hygiene. As we know, financing hand hygiene can be a major challenge. Based on the latest estimates, achieving hand hygiene in all domestic settings by 2030 would cost 11 billion USD. So there's a lot of work that still needs to be done. And so this chapter identifies advocacy strategies to make the case for both hand hygiene prioritization and investment. Next slide. The handbook also provides a systematic framework for designing and implementing hand washing programs. And we link to several behavior change frameworks throughout the chapter. You can see the 3 decisions we highlight throughout the chapter on the slide here, but the key things are to 1, determine your target audience, 2, identify factors or determinants that influence their behavior, and then 3, decide on activities that best address those determinants for your given context and budget. Next slide. And then the 3rd chapter focuses on integration, providing tips and practical examples to mainstream hand hygiene interventions based on a given context or within a broader WASH, health, nutrition, or education program. Next slide. And then finally, the last section of the handbook addresses hand washing at a systems level, identifying the building blocks within a system, such as existing institutional arrangements, policies and strategies, and financing for hand hygiene. Next slide. And so because it is a comprehensive resource, the handbook includes top-level tips and practical guidance. It does link to a number of key resources at the end of each chapter if you are interested in diving deeper into that topic. And I've linked some of the key resources on the slide here. While the Hand Washing Handbook is a key resource for hand hygiene capacity development, we were also left asking what gaps still exist when it comes to overall hand hygiene capacity building resources. So I'll actually pass it over to my colleague, Kyria Lewis-Charles, who will present on a recent review that we conducted to address this question. Kyria, over to you.
Thank you, Erin. Hello, everyone. It's great to be in this virtual space with you all today. My name is Kyria, but with a K, and I am a research fellow at FHI 360 and a second-year MPH student here at UNC. Next slide, please. Thank you. So as Erin mentioned, I will be discussing a hand hygiene desk review that we conducted. The overarching goal of this review was to assess what hand hygiene resources and trainings exist for hand hygiene implementers and to evaluate if those resources support a behavior change approach. We also wanted to obtain insight on key elements that could be incorporated into courses which the Global Hand Washing Partnership could develop in the future. During this desk review, we analyzed what resources or trainings on hand hygiene already existed online, assessed if behavior change approaches were utilized, and if so, how. We then evaluated the resources content so that we could then identify any helpful and applicable resources for hand hygiene implementers. We also noted any positive takeaways, gaps, or drawbacks of that resource. The next few slides will provide information on our findings from this desk review. So if you go to the next slide, please. So before we begin, I wanted to provide some definition of phrases that I will use to present our findings. So when I say hand hygiene promotion tools and materials, there are resources that address the who, what, how, and when of hand washing. These provide the basics to encourage people to practice appropriate hand washing. Professional hand hygiene resources are hand hygiene tools that are for specific target audiences in a professional setting. So that could be for healthcare facilities, commercial kitchens, and places that handle food. And then hand hygiene training materials are resources that provide implementers with the knowledge and skills needed to plan and implement hand hygiene interventions. Next slide. Thank you. Now to discuss the findings. So all the hand hygiene resources we identified were located via a Google search, recommendation from another wash or hand hygiene resource, or referral through the Global Hand Washing Partnership. The purpose of utilizing this research method was to identify what resources are accessible to the general population interested in hand hygiene implementers or those just seeking to learn more about hand hygiene. What we found was dozens of hand hygiene promotion tools and materials. Most of these resources utilize different media formats such as websites, videos, or online courses to target the general population or children and to address hand washing basics. We also located a variety of resources for professionals who work in healthcare facilities and food handling workplaces that was meant to support their hand hygiene practices. Of the resources we identified, we were most interested in hand hygiene training materials that address capacity development needs of hygiene implementers. For example, the washing training that we identified addressed hand washing in the specific context of emergency settings. Other examples included resources that address case studies or specific elements of hand hygiene behavior change programs, such as a number of videos which can be found in the Global Hand Washing Partnership 2020 Thursday series. Next slide. So from all the resources we identified, what we are finding is that there is still a lack of training courses for implementers that focus on teaching them how to design and implement a hand hygiene behavior change program in normal community settings. There is also a lack of materials that teach them how to advocate for hand hygiene in normal community settings. This is a critical gap that needs to be addressed so that implementers can obtain the knowledge and skills needed to provide effective and sustainable hand hygiene interventions for their communities and for their countries. Next slide. So to address these gaps, we are evaluating the development of a hand hygiene advocacy training course, as well as a hand hygiene behavior change training course that would be available to implementers who are seeking training on hand hygiene with a behavior change approach. Despite the gaps we identified in the resources, we were able to identify many beneficial course attributes that we will utilize when developing these courses. First, we will ensure that the courses are free and low of cost, are readily available for interested participants, and can be completed within a short time frame. So the reason for that is we know that implementers must juggle other work responsibilities, and so short time frames are desirable to make the course more accessible for their busy lifestyle. As we move forward with the planning of these courses, we will continue to define objective goals and tasks for the training courses. We are also considering different learning styles and languages and brainstorming how to balance the demands of developing the best course possible with available resources. And just like we did in the hand washing handbook, we will look for how to reference other resources so that we can ensure that the courses we are creating are meeting the needs of implementers and providing them with necessary information that will benefit them. Our hope is that addressing these gaps will help contribute to healthier and more sustainable health hygiene practices for all. Next slide. So to close, we've listed persisting questions for hand hygiene capacity development, which we'll discuss throughout the interactive discussion that will be happening shortly. So the questions include, are current resources addressing the major challenges faced by hand hygiene program implementers? What key thematic areas emerge as needs for future capacity building resources? And how might we link the evolving evidence base to future resources and training? I'll pass it back to Ron to facilitate the discussion now. Thank you.
Okay, thank you, Kyria, as well as Nat, Robert, and Aaron. Thank you for that very concise sharing of a great deal of information that's behind that. And now it's your turn as our participants in the session today to share your thoughts and your questions. And if we can just go to the next slide, just as a cue for action for everybody. So if you can share, how do you think the findings that were presented today resonate with your real world experience? Are there other pressing research questions? Or do you feel like we've answered some of these research questions that have been listed? For the capacity building, what capacity building needs do you see are necessary for hand hygiene champions for us to be able to achieve hand hygiene for all? Or anything else that you have to add? If you could just make a note in the chat in Pathable, and we will unmute you so that you can share with us.
Or feel free to raise your hand, and we can do it that way as well, under reactions at the bottom right.
It always would be nice to be in person, but we'll do our best with this virtual meeting. Oh, and then we did have a question in the chat. It's about where the costs number came from. Joe, would you answer that question for us? If you could unmute yourself and address that question that was in the chat.
Sure. Hi, everyone. Good afternoon, good morning, and good evening to some. Absolutely. I put something in the chat. I'm not sure if all of you saw. So the link to the full methodology can be found in the chat. But really that price tag is for the 46 least developed countries over the course of the next 10 years. And it was calculated by pulling together a model in collaboration with WASH Economics and UNICEF. And it was produced by WHO, really to pull together the figures that we have, the latest figures, joint monitoring figures that we have on coverage, and to pull together price data that was collated across a series of academic studies in order to do that analysis to see, okay, so to bring those currently without any access to having basic access to hand hygiene by 2030, what would that entail? And obviously, in order to achieve hand hygiene, there are several different components to an intervention, including the software components, so behavior change, but also looking at hardware. And so within those costs, there were certain decisions and assumptions that were made, which I think would be probably best to just read up on the manuscript, but very happy to answer any specific questions that you might have on that. Back to you, Ron.
Thank you, Joe. And it looks like we have a question here in the chat about what the current literature is on alcohol-based hand rub. Robert, would you be able to address that question for us? Just to give an update on the state of the literature on alcohol-based rubs relating to hand hygiene interventions given antibiotic resistance.
Right, thank you. And it is a very good question. Again, I do want to say our review and evidence mapping, we've started with systematic review literature. So if there's this is an area where I do think there are quite a number of primary studies that are looking specifically at the relationship between ABHR or alcohol-based hand rub and hand hygiene. But we have seen in a number of systematic reviews, specifically systematic reviews focusing on healthcare settings, that it is as effective as washing hands with soap in terms of pathogen removal or kind of our later term outcomes. I think a lot of the unknowns relate to kind of sustained maintenance or provision of ABHR within specific institutional settings, and very little and more about kind of what's the relationship between alcohol-based hand rubs and behavioral outcomes. Does it actually promote or inhibit or get people to kind of cleanse their hands at a greater rate. I haven't seen much on the relationship with antibiotic use or sorry, antimicrobial resistance. I know there was a few studies a few years ago that were finding some small levels of ABHR resistance or alcohol resistance in pathogens, but when you kind of disentangle it, it's at levels of concentration that are kind of not that are far below where we need to be concerned. But I'm not going to comment on the recent literature. I don't know if new things have been published there, but in general, we don't know very much about how to provide and get people to use ABHR. That's really where the most of the research gap is.
Okay, thank you, Robert. Appreciate that explanation. And just looking here at the chat, actually, Joanna, I guess this is a follow-up question to you on that cost number. Do you have an understanding of what the confidence of that estimate is, and if there's a range for that?
Yeah, absolutely. Thanks, Colleen, for that. So it's calculated at 95% confidence interval, and the range is actually between 10 to 12.2 billion US dollars. And I should have said that our consultant who worked on this for us, Ian Ross from Wash Economics, will be presenting the paper in full in a session just in a few hours. So I'd encourage you to join that session if you're interested in more detail on that, or to read the manuscript that I've linked. But and just to say as well that the 11 billion represents, to an extent, a pared down version of what we might consider to be most effective, bearing in mind what Robert has already presented around, persistent question marks we have about frequency and sort of dose. What we do know from the literature is that there is limited evidence to suggest that interpersonal interaction for behavior change interventions does deliver higher behavior change rates or greater effectiveness for the intervention when it comes to behavioral outcomes. And so what we did was we modeled that, looking at focusing on interpersonal component for the behavior change element, and that brought the estimate up to 13.7 US dollars. Apologies, I think there was a typo in the chat. So it was 13.7 US dollars, including that interpersonal component, and the 11 billion that we have reported in the State of Hygiene report, and we believe to be doable, is that representative of 2.5% of health expenditures across those 46 least developed countries. Back to you, Ron.
Thank you, Joe. You'll have to sit down with me later and go through those numbers a little bit more slowly. But moving on.
You should join the session. Join the session later on. It'll all.
I definitely will. We have a comment here from Nirmala Rani, and just a suggestion. Perhaps it could also be investigated whether or not hand hygiene is integrated in the school curriculum. And if it were, then what kind of impact that would have in promoting hand hygiene in children? And of course, that's a popular kind of a programming that we have for hand hygiene for all of the special situation that is. Robert, would you care to respond to that as far as a research question?
Hi, Ron. Thanks. Yeah, I think there is kind of in general a lot of information that we're missing right now about kind of delivering mechanisms, whether those are through curriculums, whether those are through mass media. As Joe mentioned in her comments, even kind of the pricing estimates that were used for this kind of global price tag really is based on the idea that it might end up having to be interpersonal communication and one-on-one kind of delivery of this. So I think in addition, kind of moving beyond just or thinking big bigger than just integrating into school curriculum. What we really need is more studies where we can compare side by side various delivery mechanisms, whether those are school curricula, whether that's mass media, whether that is interpersonal communication, or whether that's large scale policy change. Like across the board, it's an area we haven't really been paying much attention to. We tend to think of interventions and their relationship with outcomes, but we haven't really been thinking very much about what the kind of mechanisms behind those interventions are and the delivery channels that we're using. Over.
Okay, thank you, Robert. And looks like we had a question here earlier about if there's any kind of template or checklists that could be provided by hand hygiene for hand hygiene research. And I'm not sure if I understand the context of that fully. Robert, would you be able to address that, or should we ask the person speaking if they would like to be unmuted?
Yeah, I mean, if the questioner, sorry, I cannot find the chat anywhere on my computer, so I have no idea who's asking it.
It's not easy, but the question is about, and maybe we can do this. If Colleen can be unmuted, and she can ask the question and perhaps ask in more detail.
Hi, thanks. Sorry if my question wasn't clear. Yeah, I'm Colleen Naughton from assistant professor at University of California, Merced. I was, just wondering, like there's the peer-reviewed like PRISMA reporting guidelines for systematic reviews. I was wondering if you have like a guideline for because you said that all these like hand washing research don't report on what the intervention was or the details. Like, do you have like sort of a checklist if someone's publishing hand washing research that they should definitely cover like the duration and like the amount of like the dose that would be better and easier for you all to compare the research?
Yeah, I mean, so we do have the PRISMA guidelines, which are kind of the guidelines that we use for reporting and systematic reviews. I think kind of that, it's surprising if we look into the number of guidelines that exist for just any type of reporting in general. So kind of depending on the study's design, there is some type of guidelines. The Equator Network is a really good resource for finding kind of standard guidelines for any type of study design, regardless of what those are. In terms of guidelines around kind of reporting intervention content and that type of stuff, unfortunately, this seems to be an area that's kind of consistently missing across any behavioral or even intervention research in general. And there have been recent kind of calls within the kind of implementation science community to have kind of standard reporting guidelines around what interventions actually look like, how they're delivered, and those types of things. I think in the short term, in the absence of those types of guidelines, just really making sure that if we are publishing or if we're writing a report, that we actually provide that information. Most everything gets published online right now, and supplemental information can be, 1 million pages long if you need it to be. So there's really no need for us to shy away from providing this information that can really help others understand and compare and really utilize that data to the fullest of its effectiveness. And this is not just kind of for academic publications. This is for kind of NGO publications, our annual reports, all of that type of stuff. Just really, if we can provide that missing data, it's really going to help us understand what does and doesn't work to really change and really help us actually achieve universal hand hygiene.
Okay, thank you, Robert. And then we have a question from Laura Cantos, and she asks, what do you find is the best way to improve that capacity at country level? As many people still tend to focus on knowledge-based IEC materials and fear-based motivation. And she says, while we try to provide trainings from HQ, many colleagues in the field have multiple competing priorities, but having that expertise capacity at the country level could lead to stronger programs. And of course, this is an area that we continually try to build capacity and build change, that people are not just focusing on education, because what we find is that education alone does not change behavior. But as far as the best, I think the best capacity building, in my opinion, is really not just having in-person trainings, but also having that mentoring, because, people go through trainings and they learn something and then they start to apply it. They run into questions, and there really needs to be someone who's available to walk with them step by step. That would be my perspective. Any of the presenters, any other thoughts on that question? Okay. Let's see. I'm going to call on Julia Rosenbaum. I believe she had a comment to make. If we could unmute Julia.
Thanks. I actually had just a very small comment, and we really addressed a lot of it. The need for it's really a lot around your point, Ron, but that while training curricular material are absolutely essential, and as you've all highlighted, that we really can't have them knowledge-based. We have to have a much more focused look at, well, what are the determinants and how can we do it? All those things said, a training is just that. It's a training. And it's really when the learning by doing and the rubber hits the road that often various kinds of entities need that learning by doing, that sort of mentoring and accompanying the process over time. So when we do talk about building capacity, again, focus on just that and not just on developing more written training materials or curricula, but how do we find the different modalities to play that out? So that was one of my comments when the questions of how does this resonate with my experience. We do need those more focused training materials, but what we also really need are capacity building approaches that might apply in various settings and over time. Thanks. I'll add some more to the chat as we go on.
Okay, thank you, Julia. And we do have just a few minutes left here. So any comments you'd like to make in the chat or any questions, please do so right away. And, I'm sure it's been shared in the chat, but Erin, could you let everybody know where they can find the hand washing handbook again?
Sure. So I did share the link in the chat, but if you just go on our website, the Global Hand Washing Partnerships website, there is a specific tab that includes the downloaded copy of the hand washing handbook, as well as supplemental resources, including recordings from a series that we did last year, and as well as an online forum for those to continue to discuss a variety of different hand hygiene issues. I can post it again in the chat if that's helpful, because I know it tends to get lost in all of the chat, so I can post the link again.
I think that probably would be helpful. I'm getting lost in the chat and trying to keep up with everybody here. But again, wanted to ask if there's anybody else that would like to share anything. How does what's presented today mesh with what you see on the ground, or any questions you have? Please post it in the chat right away, because we do just have a few minutes left in the session. Well, thank you for everybody's participation today. Great questions, great comments. Certainly some challenging issues here as we determine what evidence basis and what capacity building has to be done so that we can achieve hand hygiene for all. At this point, I'd like to turn it over to our colleague. Well, who do we have here? I'm sorry. Turn it over to Joanna Estevez Mills. Joe is with the Hand Hygiene for All initiative with WHO, and she'll be giving us our closing comments if we can change the slide.
Thanks, Ron. I'm actually managing the slides as well, multitasking. So you should have the slide, the relevant slide in front of you. And if not, that's just, there must be a lag. And thank you everyone as well for what's been a really stimulating session. I've really appreciated the session structure, juxtaposing what we know about capacity needs with what the literature tells us about gaps in our understanding of what works for hand hygiene. I found the points raised around how to make hand hygiene interventions more effective and efficient, particularly pertinent in the current environment as government health and WASH budgets are more constrained than ever following the COVID-19 pandemic. Improving both the efficiency of hand hygiene programs and how we document their cost effectiveness feels more important than ever. I've been asked to provide some brief remarks on the way forward following this session. And in that vein, there are three main points that I want to make. The first, perhaps obvious, that let's not lose sight of what we do know. And it may seem an obvious point, but one danger with sessions such as this one, which are interesting precisely because they do hone in on persistent questions that we have, is that we may feel paralyzed by uncertainty. And the WASH and health sectors have a wealth of knowledge and experience on what works to change hand hygiene behaviors. And the last 18 months have shown us just how much headway we can make with strong political leadership. And I know I've just been looking at the chat throughout the session. There have been several different resources shared, which I think would be really worthwhile as a next step to look into if you haven't done so already. The second point I wanted to make was, let's place greater emphasis on documenting our work. I think a lot of what we've heard here today calls for clearer and more systematic recording of how current interventions operate, how they are evaluated, and what lessons we've learned. So let's not leave this interesting discussion in this Zoom session, but let's take it back to our day jobs and reflect on how they might influence our work. This is especially important now. As I was saying, there's so much interesting work on hand hygiene has been and is still happening in response to COVID-19, but it hasn't necessarily been documented or evaluated as it should be because of the situation we've been in. I think we have a lot to learn from the quick action of the last 18 months and from how barriers and challenges have been, that have traditionally stalled progress on hand hygiene to date were overcome in the name of emergency response. So what can we learn about that? And in particular, Robert's point around the policy environment for most conducive to hand hygiene improvements. Well, what can we learn about the last 18 months? I think would be an interesting thing in terms of a way forward. And my third and final point is to flag just a few significant ongoing global processes that I think will also be important conduits for this discussion and sort of in terms of next steps. These are all happening under the banner of the Hand Hygiene for All Global Initiative, and they're not the only ones, but they are somehow most pertinent to raise in terms of a way forward from this discussion. And the first, focused on filling gaps in the literature, is a process that Robert has already flagged. So it's the next step in the evidence synthesis and gap map that Robert presented. A series of setting-specific consultations are underway to arrive at a demand-driven, sort of prioritized list of research questions, and discussions here today will inform that process. Secondly, and in terms of laying the groundwork for building capacity and plugging those gaps that were identified and shared today, WHO is carrying out a synthesis, sort of a rapid synthesis of existing guidance for hand hygiene programming so that we can more systematically understand what guidance is currently out there and what the gaps are. Thirdly, in building on this, WHO is embarking on a process to develop a set of formal WHO guidelines on hand hygiene outside of the healthcare setting. So, in households, public spaces, and possibly schools and workplace as well. And the questions that that guideline will answer, the focus of those recommendations will be wholly demand driven, and sessions such as this one are providing invaluable inputs into that process, and there will be other formal opportunities for consultation, which you'll hear about in due course. And fourth and final, we're currently designing a process for collating and learning from hand hygiene progress in the last decade or so, including from the COVID-19 response, and trying to draw lessons from that. So sort of a multi-country evaluation of what common levers across countries have really worked to drive progress on hand hygiene. And with that, just to sort of provide a few ideas for the way forward, I think one of the most important things is to keep talking. And I find this sort of session really, really stimulating. So I just want to take this opportunity before closing the session to thank World Vision for having sponsored this lunchtime session and given us the opportunity to come together and discuss. Thank you very much. Ron, I don't know if I need to hand back to you or close the session. So apologies, I was unclear on that, but thank you all. Bye.
Now, just to say thank you to everyone.
Great. Thanks, everyone. And please do continue to use the Pathable chat. It should be open for the rest of the conference. So as more comes along, please feel free to add on to the conversation. Thanks, everyone.